Hello, welcome. I'm Dr. T, Pam Terrio. I am the author of Alleviate Dry Eye, the book, and also the director of the Dry Eye Clinic here at Lusk Eye Specialist here in Shreveport, Louisiana. Thanks for joining me today. This month, January, is Glaucoma Awareness Month. And so I wanted to talk a little bit about how glaucoma and dry eye are related. And so if you've been following me for a while, you probably know what dry eye is. You probably know that it's an irritation of the front surface of your eye that can cause your eyes to be red, gritty, irritated. But what is glaucoma? So glaucoma is what we call the silent thief of vision. It is a disease that causes you to lose your peripheral vision. And it does that over a very long period of time, but there's very few signs to a patient that they are suffering from glaucoma until their vision can become very narrowed. And so that is why we encourage people to get eye exams once a year to check for glaucoma. Now, what I want to talk about specifically today is if you have glaucoma and you also are starting to notice dry, red, itchy, stingy, burny, watery, irritated eyes. Those are symptoms of dry eye, and it could be part of your glaucoma treatment that's either causing or exacerbating some of those dry eye symptoms. And so what can you do about it? So I want to first say that if you have glaucoma, please watch the rest of this video and hear what I have to say. But first, before you do anything, you have to check with your eye doctor that you're seeing that is treating the glaucoma, because we're going to be talking about some prescription ways to deal with the red eyes and glaucoma. So if you have glaucoma, please make sure you're following up regularly with your eye doctor. Like I said, it is the silent thief of vision, and glaucoma can cause you to lose vision. It's a very serious disease. It's sight-threatening, and you need to make sure you're getting regular eye exams. However, if you are seeing an eye doctor and you're getting treatment for your glaucoma, then what I want to tell you about is a couple of options that if you're suffering from the redness, the irritation, maybe some dry eye, that you could talk to your doctor about changing your medical regimen, your medications that you're taking, and get some relief from the dryness. So first of all, thank you for being here. Thank you for joining me. And the best way to go about treating dry eyes is a simple four-step process that I've talked a lot about already, which consists of lid scrubs, warm compresses, artificial tears, and taking a dietary supplement for dry eye that will help give your body the building blocks it needs for healthy tears, so an omega-3 supplement. So those are the four steps that I always start off with my dry eye patients to recommend to them. So if you have glaucoma, you can just add this to your glaucoma treatment regimen and get some relief with these four simple steps: lid scrubs, warm compresses, artificial tears, and finally doing a omega-3 fatty acid supplement. All right, now, oftentimes, patients with glaucoma suffer from irritation because of the preservatives that are in their glaucoma medications. Glaucoma is a long-term disease, and you may be on treatment for longer periods of time. So the preservatives in the medications can cause irritation. So one of the biggest preservatives that we find in prescription glaucoma medications is BAK, benzalkonium chloride. And this is quite irritating to the eyes over time. So one way to fight this or combat this would be to switch to a drop that is BAK free. So this drop, Zelpros, has been on the market for a few years now, and it is BAK free. It does have a preservative in it. It's a once-a-day glaucoma drop, which helps to lower your eye pressure, but it does not contain BAK. So that might be a good option if you are starting to notice that irritation. Now, the next step would be to go with something that's completely preservative-free. In the last few years, there's been a lot of new drugs come to the market that are preservative free. So your usual glaucoma medications that you've already been taking are now available preservative free. This one is called Xioptin, and it would be a replacement for latanoprost or Zalatan, Lumigan, Travatan, something that you're taking once a day at bedtime. This is a preservative-free version of that drop. There are also preservative-free versions of Timolol or Cosopt. There's several different ones out there. So again, if you have glaucoma, talk to your eye doctor about switching to something that's preservative-free that would lessen the irritation in your eyes. And the final one I want to talk about today is Durysta. This is a new medication that's actually implanted into the eye. So it's not an eye drop. It is a procedure that you would need to have at your doctor's office, but it can lower your pressure, and you would not need to take drops with that procedure. So it would be a procedure that you have in the doctor's office. They implant the medication into your eye, and it can last 6 to 12 months. It is new to the market, but many eye doctors are offering that as an option to their patients who have trouble with their drops, or maybe are seeing a lot of irritation with their eye drops. Finally, there's also glaucoma surgical procedures that can be done to reduce the amount of eye drops that you're taking. But overall, I just want you to know that if you are suffering from dry eye related to your glaucoma medication, there are many options out there to help alleviate that irritation that you're having. So if you're in the Shreveport area, I'd love to see you at my clinic. You can find out more information about me at pamterrio.com or at luskeye.com, and you can get an appointment scheduled with me. Remember that if we take care of our eyes today, our vision will last us a lifetime. Thanks again for joining me, and I'll see you next time.